Hi everyone, Dr. Fong here, and I'm talking about parasites and skin disease today. Now, this is a really common thing that I find, and it goes largely undiagnosed. Actually, parasitic infections in general really go largely undiagnosed, and it's really more common than you might think. Certain symptoms that might indicate that you have a parasite infection. Skin disease is a big one, so rashes, eczema, hives, any just itchiness, general itchiness in the body really can indicate that there potentially could be a parasite infection. But even other symptoms, of course, gastrointestinal symptoms can be a problem, nauseousness, bloating, etc. But other symptoms include things like mental health disease, like anxiety, insomnia can be a problem. It can also be related to like even muscle and joint pain. If you have itchy symptoms like itchy anus symptoms, itchy vaginal area symptoms, or excess discharge in those areas as well too. Somebody is saying that they used to see eggs in the stool. You can actually see in your stool. You might see, a lot of times you don't see anything in the stool, but sometimes you can see like even little squiggly kind of lines in the stool, or even eggs in the stool as well too. And it's really more common than you might think. So it's not always that you are, having all of these huge gastrointestinal problems if you have a parasite infection. And yes, it could be skin disease symptoms that you're getting, in addition to all these other hosts of symptoms that I mentioned. So again, really more common than you might think. So where are we getting these parasites? Well, it's also really easy potentially to have exposure to parasites. So if you handle things like, undercooked meat, or eating undercooked meat, or even soil, or of course, poor hygiene. If you travel to a tropical destination and you come back and you just haven't felt well ever since, that's a really common one. Maybe my patient might have gone to Mexico, and then they just realized that after that, things have just been a little off. Their eczema started, their gut's been a little bit off, but not anything too crazy where they're not having diarrhea all the time. So this is why it's really hard to diagnose parasite infections, just because, you might not even have very outwardly presenting symptoms where your doctor is going to say, oh, let's look for parasites, okay? But if you are having any of the symptoms that I listed here, this might be something you might want to really consider. And parasite testing is really doing stool tests. So you'll work with a naturopathic doctor like myself, and we will have you collect your stool at home. You'll collect that stool, and we'll see if there's any parasites in your system. So this testing is really important. I would also say that sometimes people have parasites and it doesn't come up on testing. That's also a possibility. So I've had patients who have like worms, like literally in their stool, and you can see it. And it didn't get picked up on the test. And that's another possibility is, sometimes these tests are not picking up on every possible parasite that we could be having in our system. So what's the problem? Well, the parasites release a toxin or toxins, and they release toxins into the bloodstream. And then those toxins will cause problems in the system, just like any toxin that we have. And if you guys follow me, I talk about toxins a lot. I talk about the system being bombarded by toxins and overburdened by toxins. I love to talk about this theory I created called the detox funnel theory. Everybody has a detox funnel, and for the most part, if you have any chronic disease, your detox funnel is overflowing. So when we're talking about parasites, those parasites release toxins, and those toxins now will cause burden on your system, and will start overflowing. And where is one of the first places those toxins are going to go? They're going to try to exit via your skin. So when talking about skin disease, this is something I find really commonly, and the presentation often looks a certain way. So if we have a discovery consultation together, I always ask you to post a lot of pictures, close-up pictures, far-away pictures. That can really help me to understand if a parasite infection is something we need to consider. And if I do find it, then we need to treat. So what does the treatment of a parasite look like? Well, it will look like, first of all, we have to clean up the detox funnel, get it working well. And those detox funnel organs include all of your organs of detoxification, your gut, your kidney, your liver, your gallbladder. So we still have to clean those up. It's not any different from detoxing any other toxin from your body. We have to make sure the pathway is working well. Once that pathway is working well, we then need to kill this bug, right? So we need to kill this bug, but then the problem is when you kill the bug, toxins are going to be released, and those toxins need to be able to go out of the body. So we need to make sure that all of those detox mechanisms are working well. And so when we kill the parasite, they can exit the body. I think this is what I find is the most common problem when people come to me and they say, oh, Dr. Fong, I've been doing a parasite cleanse. And what I find is that oftentimes those people are killing the bug without helping the toxins get out of the body properly. And so sometimes when people do parasite cleanses, their symptoms get worse. So like people with skin disease, for example, if you're doing a parasite cleanse, your skin disease might actually get worse when you're doing a parasite cleanse. Is that what I want? I mean, no, not really. What it means is that you might actually not have been ready to do that parasite cleanse yet. You might have needed to open up your detox pathways first. And that's one of the problems that I find in people doing these parasite cleanses alone by themselves without a doctor behind them, or even sometimes they are being led by a doctor and the doctor isn't opening up these pathways. So especially for you guys with skin disease, you do want to kind of be careful and make sure that you have opened up those pathways before you start killing that parasite. Okay. So what else does the parasite do? So not only is it releasing toxins into the bloodstream, which now then causes this huge burden on the body, and then it causes those toxins to try to exit via the skin, and then you have all these skin issues. But then you can also notice weight loss because the parasite will eat your food, and you might be eating your food and you're never getting, full, and you just keep you want to eat and eat and eat, and then maybe you're eating so much and you're still losing weight and you're not gaining weight. That could also be another sign that you have a parasite infection. Okay. So I'd like to open it up to any questions now. Anyone who has any questions about parasites in general. Places that I also want to mention that you might get exposure are sushi. So I think any undercooked meat is a potential for you but getting exposed to parasites. I think sushi is a big one. I've had patients with worms in their gut and they love sushi, and I think that can be a big problem. So, I used to love sushi. I actually tend to not eat undercooked, raw fish anymore if I can help it. And so I will go to a sushi place and I'll just get the cooked sushi rolls. And then, of course, I'm also trying to avoid tuna because tuna has a lot of mercury in the system. So I will avoid the tuna as well too. So I'm really just getting, maybe potentially a salmon. That's a cooked sushi if I'm going to a Japanese restaurant. And then how do you know when you're ready for a gallbladder flush, or is it better to start with TUDCA? So TUDCA is great. That's a bile acid, and that will really help in terms of hopefully creating more bile for you. You know when you're ready for a gallbladder flush when all of the other detox pathways are open. You cannot do a flush if your gut, your kidney, and your liver is so congested. So in my program, we really prep you and we really clean up the gut, clean up the kidney, clean up the liver, and then we finally flush the bile. And when you don't do it in that direction, it's going to be potentially not really a good result, because you're now flushing the system and it's not, open in terms of getting those toxins out. I missed the person who just wrote, any thoughts on ear rashes? If you can rewrite your message, then I'll go ahead and answer that. Seeing Dr. Fong, her and her team are the best. Oh, thank you. Long eczema and Hep B patient, now seeing the light with her program. Woohoo! Thank you for mentioning that. I appreciate it. Any relation with eczema and PCOS, inflammation in the entire body? And then someone's asking, are there particular areas of the body that show any skin issues when it comes to parasites in the body? Okay, let me answer the PCOS question first. Absolutely. Why is that? Well, PCOS oftentimes is an imbalance in the hormones, and it's often an estrogen dominance, high estrogen, high testosterone problem. And that's absolutely kind of just related to detox problems, eczema even, etc., because it really means that that funnel is really full, it's overflowing, and you are having a hard time metabolizing these hormones. It could be because you have a lot of estrogen-like toxins in your body. It could just be because your liver and your gallbladder are so congested that you're really having a hard time metabolizing those hormones. And so therefore, because you can't, let's say, get those hormones to go out of your body, they become really high in your body. I often see PCOS related to a lot of other chronic diseases, just because it can, for women, because it can really be related. Are there any particular areas of the body that show skin issues when it comes to parasites in the body? I would say not necessarily, but there is a little bit of a presentation that that if I see a certain type of presentation, especially if it's like all over the body or if it's very severe, and there's a way that the eczema often looks, that I'm cued to say, okay, I think we should look into parasites, and especially if there's gut issues, if there's, any kind of gut problem, and then if there's a host of issues, I will often want to look for parasites. Is skin picking also a part of parasites? Actually, characteristically, yes. Often if there's someone who's doing a lot of skin picking, this is kind of a more homeopathic approach. We might say, okay, we want to look into parasites. So absolutely. Other thing that I've noticed with parasites is nose picking, especially for kids. If we see a lot of nose picking, that can actually be really related potentially to like worms and other types of parasites as well too. Okay. Great questions, guys. And yep, I'm happy to answer all the questions we have about parasites and skin disease. I will also be answering questions tomorrow at my live masterclass. And my live masterclass is kind of really a more expanded version of what I'm doing here today with my IG Live. I won't only be talking about parasites, but I'll really kind of break it out in terms of all of the different things we need to look for. That includes like parasites and mold and heavy metals and environmental toxins. Parasites release a toxin, and that's only one of the toxins we need to think about. We need to think about a whole host of other toxins that could potentially be burdening the system. And then we also need to think about other things, just like lifestyle and diet and mental health and traumas and things like that could be playing a role. So I'll talk a lot more about that in my live masterclass tomorrow. If you guys haven't come to that already, it's free, it's virtual, and it's at 11 a.m. tomorrow. If you can't make the live masterclass, sign up anyways, because we'll have a replay, and for 24 hours after the replay, I will actually answer questions via email. So you guys can go ahead and sign up anyways, even if you can't make the 11 a.m. Okay? I've had eczema for about 12 years now. What detox method would you recommend to get rid of the parasites? Okay, I will answer that question. I did want to just kind of piggyback on the masterclass. I did forget to tell you where you can sign up for that. On my profile, you can just click the link in my bio. That's actually our webpage. And at the top, you'll see a button that says free masterclass. Just click it and then you can register right there. Okay? So I would recommend for you, you've had eczema for 12 years now. I don't know if you have parasites. Again, not everybody with skin issues has parasites, but a large portion of people with eczema potentially have parasites. So we would need to test you. We would need to understand this more. So my suggestion is to start by going to my masterclass tomorrow, because I'll kind of lay out, what are the things we should be thinking about? What is the approach? How do we actually test for these things? What is the approach to actually treating this? And I'll answer all of your guys' questions there as well too, but instead I'll have slides. So it'll kind of be a little more in-depth in terms of answering your questions in regards to this, okay? So go to the link in my profile and sign up for that live masterclass tomorrow if you guys want to know more in-depth information about what we're talking about today. But I am open to answering any other questions that you guys have today about parasites and skin disease. Again, something I find so commonly and hidden, really, like you just don't know it. Your doctor is not even thinking about it. No dermatologist is really ordering these types of tests because they're just not thinking this way. They're not thinking that potentially the parasites are releasing these toxins. Those toxins are now causing the skin disease that you have, okay? Franco, is there a customer service number where I can make the appointment? Yes. You guys, we have a message line and we can give you a call back. That's 650-396-7117. And again, 650-396-7117. Okay. Can parasites be connected to acne? Absolutely. So I find this really commonly too. So I would say eczema, I would say hives, I would say acne is a really common one. And acne, I find actually quite common as well too, a dysbiosis in the gut. What does that mean? Well, your gut really should have a good balance of bugs, right? It should have good bugs, bad bugs. And your good bugs should really be, it should be kind of the war, like, the army that's like waging the war against the bad guys, right? So if you have a lot of good bugs in your system, you might be exposed to a parasite and that parasite will never cause any problems. That's a possibility. So one thing I should say is the stronger your gut health, the stronger you don't have any symptoms of gut, bloating or a lot of gas or anything like that, the stronger you're going to be able to fight off any parasites. So I think the problem is that sometimes people with eczema or already kind of having skin disease or gut issues, maybe they don't have a parasite yet, but then they go to Mexico and their immune system is so weak that they're very open to a parasite. And now they take on the parasite takes on their system. And now the eczema kind of exponentially gets worse. I see this a lot too. And that might be the case for you. If you traveled somewhere and then all of a sudden after that, you noticed your skin has been the worst it's ever been and you really haven't been able to fix it. And conventionally, right, you're going to your doctor's just giving you steroid creams, prednisone, all of these things to just lower the inflammation. And I like to say that that's just really decreasing the alarm system that's going off. You're not really getting to the root cause when potentially that root cause is, first of all, a clogged detox funnel. You cannot detox properly. Then secondarily, what's filling that funnel? Potentially parasites, heavy metals, environmental toxins, etc. So we need to really understand if that's the case and help your body to kill it. We will also use antimicrobials, anti-parasitic herbs, and we will flush those guys out of your system so that they never come back. Then after that, we will want to boost your immune function. And if we can boost your immune function, then even if you're exposed to a parasite in the future, potentially you're not going to have a problem, okay? So a couple of items that I want you guys to pay attention to so that you just avoid getting parasite infections in general. Really good with washing your hands. Try not to eat food from the street because they might not be washing their hands and potentially they would have, you would be eating a parasite-ridden food. Undercooked meat, make sure you're cooking your pork all the way through, your beef all the way through. I posted some pictures today of like people who had parasite infections from undercooked beef and pork. Okay, so make sure that you're cooking those all the way through. I really would recommend maybe avoiding sushi, raw sushi, and just doing only cooked sushi when you go to a Japanese restaurant. And you know, if you are traveling to a tropical place, consider doing like a probiotic, just to make sure that you are supporting your system as much as you can, your immune system, just in case you come across a bug when you're traveling. Okay. Can prednisone give you side effects? Absolutely. So prednisone, you know, you're basically lowering your inflammation really quickly by giving yourself a steroid hormone. And your body's supposed to be making that steroid hormone itself. So if you are using a steroid hormone, you're using a drug that's essentially replacing the thing that your body's supposed to do. And this can really affect your hormones. And it can have numerous side effects. So too many to list here because, so it kind of depends. Like, did you take prednisone once? Did you take it 10 times? Are you taking it for a long period of time? The longer you take it, the worse off it's going to be because your body's going to really get addicted to it, right? And then your body may not make the hormones the way it's supposed to on its own. Okay? All right, guys. So if you have more questions about all of this, skin disease, chronic disease, parasites, what other toxins are filling your funnel and potentially causing your problems, definitely try to make it out to my free masterclass tomorrow, Wednesday at 11 a.m. And you can sign up for that on my profile. Just click the link in my bio. And once you click that link, you'll see a blue button. It says free masterclass and you can sign up right there. Okay. And someone is asking about impetigo in children. And you know what I would say about almost all skin disease? Almost all skin disease is caused by some kind of toxic burden. And we just need to find out what toxic burden is the problem. And oftentimes it could be parasites, but it also could be heavy metals, but it could be environmental toxins. And yes, in children, this is also a possibility. Why? Well, I've talked about this before, but us moms, we could have given our kids our toxins, which is a problem. Our microbiome will affect our kids' microbiome. So if you, mom, have an imbalanced gut flora, you also could have caused your child to have a bit of a imbalanced flora. If you were given antibiotics or your kid was given antibiotics, this can cause an imbalance in the microbiome. There's lots of reasons. So it's hard to, when someone says, like, what's the cause of this? Well, it's not usually one cause. And usually there's maybe up to 5 to 10 causes. So we need to really understand all of that. In my masterclass tomorrow, I'll kind of break out all of those different potential causes. Parasites are one of them, and parasites are a big one that I often can find. So we can do some testing, we can figure that out, and then we can treat in both children and adults. I find parasites also in children too. And that's a big possibility. Okay. All right, guys, I'll open it up to a couple more questions and then we'll head out for today. I will be posting this on my Instagram as a IGTV and as a post. So if you know anyone who needs to hear this information, definitely forward it along. I think this is something that goes really undiagnosed and it's really common and we need to fix it, right? Because if you just keep treating the symptoms, you're never going to get down to that root cause. And this is one of those things that can be a root cause that when you find it, like, things can get so much better so quickly if you find it and it's really truly the root cause. And for some people it is, and for some people it isn't. And we just kind of need to do some digging to figure that out. Okay? All right. Thanks, everyone. I don't see any other questions coming in. I hope to maybe see you guys at my live masterclass tomorrow at 11 a.m. Again, sign up in the link in my bio. Otherwise, I'll see you next week for my next IG live. All right. Have a great week, everyone. Bye-bye.